my name is Kathleen Cooper, and this is Hospice Nursing. The first question asked is, what are the primary activities performed by the nurse and what is the scope of practice? And the hospice nurse's primary activities are direct patient care, which involves wound care, documentation of vital signs, medication administration, and ensuring that we keep the patient as symptom and pain-free as possible. We also, as hospice nurses, provide emotional and spiritual as well as psychological support to our patients, their family members, because as the bond forms between the hospice nurse and the patient, you're able to provide more support and improved care. You can ease anxiety and consult extra resources that the family or the patient may need. The hospice nurse helps to ensure that the patient does not die alone. It is the goal of a hospice nurse and the hospice team to ensure that somebody's with the patient during their final moments. Generally, that's the chaplain or the hospice nurse trying to be with the family and the patient in their final hours. The hospice nurse continually improves the quality of care, and they do this by bridging the gap between the hospice team, the patient, the caregivers, the families. They are kind of the social worker of that aspect of bringing them all together in their care. The scope of practice of a hospice nurse is no different than that of a standard RN, and varies state by state what is required to become a hospice nurse. In the state of Florida, you just need an active RN license with an associate's degree in nursing or bachelor's degree in nursing. But the American Nurses Association states that the scope of practice described is the qualified health professional is deemed competent to perform and permitted to undertake, in keeping with the terms of the professional license, the nursing scope and standards of practice that describe the who, the what, the when, the where, and the why of nursing practice. There's no other, it says what teaching and learning strategies can be applied to addressing specific issues related to the core population. Using professional development-based strategies help the hospice nurse to learn and care for their core population. Educational topics such as ethical and legal principles of palliative care, learning about grief and loss, pain, symptom management, different cultural differences, and communication. Evidence shows that when hospice nurses are taught these through their teaching strategies in pre-licensure, that they are more likely to have a better understanding and be more professionally developed as hospice nurses. Education, there's no separate education preparation to become a hospice nurse. There's no additional degrees required. However, there is an additional skill set that is required. Some of the skills needed are firm foundation and home care skills. Most hospice nurses work in the homes with the patients and not necessarily in facilities. A good foundation of the community resources that are available to the patient's family, patient and their family, as well as the caregivers. The ability to function as a constructive team member, and the ability to comfort with death and dying. Being a hospice nurse also takes a toll on the nurse. They carry those emotions, and passion fatigue can be a serious issue with hospice nurses who aren't able to deal with the comfort of dying well. The hospice nurse needs a firm foundation of home skills, knowledge of the community resources, and the ability to function constructively as a team member. This is what other disciplines or professionals does the nurse interact with as a role, and to explain that will be Chelsea.
Hi, I'm Chelsea, and part of the disciplines that the hospice nurse interacts with are physicians. For instance, at my hospital, we use community hospice, and we actually had a seminar with them, and they told us that a lot of our physicians actually don't know how to properly speak with the families. A lot of the time, they'll speak as if the patient isn't there, about their care and what they want done, and it's the community hospice's duty to make sure that our physicians know how to have a caring relationship with the family and how to properly speak with the patient and include them in their care, because it's a patient-centered focus. And a lot of the times our physicians aren't including the patient, the one who's actually in hospice. Some of the other professions they work with are the floor nurses. A lot of the time, these patients go to the hospital for care, and then they work with the case managers to be transitioned into hospice care. So a lot of the time, these hospice nurses do have to work with the floor nurses. They also work with the social workers, chaplains, especially for the spiritual care. They also work with the home health aides who will come and help with that patient once they are settled into their house. They also work with bereavement counselors for the family for before, during, and after the passing of the patient. They also work with dietitians to help, because a lot of the patients in hospice have lost appetite, and we do want them to be nourished as best as possible. They also work with pharmacists to make sure that we have all the correct pain medication and the medications they need to be comfortable in this transition. And then one new discipline that I came across as a nurse about a month ago was a death coach. The family actually hired someone who comes and helps the patient transition from life to death. They sit there, they encourage them, they tell them that it's okay to actually go, and I just thought that was interesting. Some of the skills that a hospice nurse is required to have is critical thinking, especially the triage nurses. They have to be able to assess the situation and make sure that it's not an emergent situation. And if it is, they need to work with the physicians and the case manager to see if the triage nurse actually needs to go to the house and help the patient. Another thing is compassion. If you're not compassionate in this line of duty, you can't really be a hospice nurse. You're there for the end of life care and to help the patient transition. You also need to be able to provide education. You have to educate the patients about the disease process that is going on and ways to help them, help through the pain, and then also spiritually and psychosocially and emotionally. You have to be able to educate the patient and the family on that. You also need to have effective communication. If you cannot collaborate with the other disciplines that you come across, the care plan might not work for this patient, and in order to do so, you have to be able to communicate effectively. You need to provide quality care. Quality care, you want to make sure that the patient is as comfortable as possible, and without that quality care, a lot of things can get missed along the way. Again, psychosocial. You want to counsel them, give them grief support. You also want to give them emotional and spiritual support. One of the things that I found most interesting in this profession is how multifaceted it actually is. There are a lot of different positions, all for this one family, the one patient. And the first one is an admission nurse. The admission nurse guides the patient and family through the assessment and admissions process. They also educate the family on what they can expect with hospice care. They also determine eligibility. Not everyone is going to be eligible for hospice care. It might depend on the company, and then they can also refer them to other outside companies, because a lot of companies work with the hospital, and that's the liaison nurse, which I'll get to next. And then the admissions nurse also formulates the care plan. They are that important step to make sure that every step is met. That's why they work with the other disciplines to make sure everything is covered, to make sure the patient is comfortable. You also have the case managers. Those case managers work with the rest of the team, the physician, social work, chaplain, whoever may be involved in the case. They also decide how the resources are allocated, and they also formulate the plan of care for each patient. They also determine the level of counseling and education and the care before, during, and after the death of the patient. And this is for the families. You also have visit nurses. Visit nurses are the ones that provide the supplemental care for the case managers. They're the ones that go to the homes, follow up on the wound care duties. They also administer the medications for the patient. They can also help teach the family members how to administer those medications. And they also ensure that the proper documentation is being followed and executed. And then you have your triage nurses. These are the ones where the critical thinking really comes into play. They have to take emergent calls from the family. They have to assess the situation and understand all the specific needs of the patient. And then once they understand what's going on, they then need to inform the case manager, the visiting nurse, and the physician. From there, they determine if an immediate visit is actually necessary. This position is a high-stress job. You're remotely working, you take these calls over the phone, and you have to use your critical thinking skills to really assess the situation. And then it's your job to take control of that situation as well, and to make sure that the needs of the patient are met.